Morning. Today we are going to discuss about the essentials of teeth bleach. The essentials of teeth bleaching, including the bleaching materials which is commonly used, and advantages and disadvantages, and indications and contraindications, as well as bleaching mechanism. So these things we will be discussing in today's class. Aesthetic is the science of beauty. So aesthetic is a synonym to the beauty. Aesthetic dentistry make one look younger, healthier, and confident. But what if you have a discolored teeth? A discolored teeth surely compromise your aesthetics and beauty. So you have to do something for your discolored teeth. So everybody wish to have a white, clean teeth. So in this discolored scenario, our main goal is to get a lightening of stained teeth. It should be done without disturbing the biological tissues, and periodontal environment is mandatory. So our goal is to get a lightened teeth without encroaching into biological tissues or without compromising the biological tissue health. And this particular bleaching, dental bleaching, is nowadays used as a great marketing tool. People gives a lot of advertisement and attract patients to the clinic by enhancing this teeth bleaching procedures. The teeth whitening is the lightening of color of the teeth through the application of chemical agent to oxidize the organic pigmentation in the tooth is referred to as bleaching. History, when we come to the history, you can see bleaching was unsuccessful in Middle Ages, used in the Middle Ages. When modern bleaching technique began in 1918, Abbott used the combination of superoxide and heat. 1961, walking bleach introduced. 1965, thermocatalytic technique introduced. And 1967, combination of walking bleach technique is introduced. 1968, home bleach concept of vital teeth is introduced. In 1982, intentional RCT with internal bleaching for tetracycline stains that introduced by Ras. And in 1987, in-office bleach introduced. 1988, first commercial bleaching product, white plus white, came to the market. 1989, Kroll introduced microaberration technique for vital teeth. And in 1989, using 10% carbamide peroxide in a custom-made tray worn at night, and it coined a term like night guard vital bleaching technique. 1991, Gerber and Goldstein introduced a combination bleaching, that is power bleach plus home bleach. So you do first power bleach, then for getting the continuous result of that, to maintain the result, you will continue this a home bleach for some time. In 1996, Reto introduced laser tooth whitening. In present day, we use plasma arc, laser, light activated bleaching bleaching power gels for in-office bleaching. So in-office bleaching become very popular nowadays. The tooth discoloration can cause due to several factors. The main cause of tooth coloration can be categorized into three categories. One is extrinsic discoloration due to external stains, or it can be intrinsic discoloration, which is produced from inside. And the third one, a scenario known as stain internalization, has recently been described to include these circumstances where extrinsic stains enters to the tooth through defects in the tooth structure. Post-eruptive causes of intrinsic stain can be dental caries, as you see in the diagram, dental caries, discoloration due to amalgam restoration, discoloration due to composite restoration, or it can be due to aging, attrition, erosion, smoking, or parafunctional habits. So extrinsic discoloration can be plaque and pellicle yellow, coffee stain, tea stain, black stain from chromogenic bacteria, green stain from chromogenic bacteria, or stain induced by use of chlorhexidine in mouthwash. These all are the causes of different types of whether internal or external stain. In external stain, if the tooth has got so many cracks or something like that, it will go into the internalization of the external stain, which has to be considered in teeth bleaching. The indications can be generalized staining, aging, smoking, and dietary stains such as those of tea and coffee, fluorosis, tetracycline staining, traumatic pulpal changes. So it depends on the cause of the stain. Cause of the stain, we have to select the methodology of bleaching also. We have to select the whether you have to go for internal bleaching, external bleaching, home bleaching, power bleaching, combination of power bleaching, whatever. So diagnosis and treatment plan is very important. Case selection is very important. The patient selection inclusions are basic shade minimum of D2 should be there. Only in such situation we can show the enhancement of the shade, and willingness to avoid stains. Staining food or drinks for 48 hours post-operative is very important. The patient has to be taken care of for at least for 48 hours post-staining period to prevent the restaining of the tooth structures. And minimum of 6 to 12 teeth should be there when you select a case. You cannot bleach only very few teeth, 1 or 2 teeth, which the result may not be that good. And the periodontal condition of the patient should be very healthy. Otherwise, you cannot go with the bleaching procedure. But there are certain contraindications for the bleaching procedure. The patient with high expectation, which cannot be dealt with, and decay and periapical lesions, multiple decays in periapical lesions. Pregnancy is better you avoid this cosmetic bleaching technique and pregnancy time. And severe sensitivity cases, cracks, and exposed dentine, such situations better you avoid. Existing crown and larger restorations in smile zone is avoided. And elderly patient with visible recession and yellow spot, yellow roots, you can avoid. Patient selection exclusions are severe oral pathology, orthodontic appliances, wearing patients, gingival inflammation, cervical erosion, as we told, extensive calculus, severe sensitivity, teeth with laminates, crowns, and large composites, decalcification, tooth decalcification, as we told, pregnancy, and those who did whitening within the last 6 months, it is better you avoid. Ideal requirement of bleaching agents. It should be natural pH and neutral pH, and easy application. Not irritate and dehydrate oral tissues, and should not cause any harm to the tooth being bleaching. Adhere to the tooth structure and contrasting color with the oral structure. Adjustable peroxide concentration, desired result with a short time, controlled by the clinician to customize patient needs. These all are ideal requirements we expect with the material which we use. But each and every material may not meet with all these ideal requirements. But these are the requirements which we are likely to have. Normally, the commonly used bleaching materials are hydrogen peroxide, carbamide peroxide, and sodium perborate. This hydrogen peroxide and carbamide peroxide are extracoronal bleaching agents, while the sodium perborates are commonly used for intracoronal bleaching, or otherwise known as internal bleaching. Composition of commercial bleaching agents. Current bleaching agents include active ingredients such as hydrogen peroxide and carbamide peroxide compounds. Inactive ingredients such as thickening agent or carbopol, which give consistency to the material, and high molecular weight polyacrylic acid. It increases viscosity of the bleaching material, which allows better retention of bleaching gel in the tray. It increases the active oxygen releasing time of bleaching material by up to 4 times. And it can be added with some carriers, glycerins, surfactant, which permit the active bleaching ingredients to diffuse or pigment disperse and keep the pigments in suspension. And it can be have some preservatives like methyl or propyl paraben or flavoring agents such as peppermint, wintergreen, etc. Hydrogen peroxide stored in refrigerated container where it retains sufficient potency for approximately 3 to 4 months. 30 to 35% stabilized solution of hydrogen peroxide is the most commonly used material for bleaching as bleaching agent. It's clear, colorless, odorless liquid. And normally this liquid is stored in amber colored bottle because it has to be prevented from the light. So light will activate the solution. So the efficiency of the solution will be compromised if you open the light, open that material into light. The concentrations used in brands of hydrogen peroxide and carbamide peroxide. Hydrogen peroxide, most of the brands are using 35% of hydrogen peroxide as an in-office bleach. But in the case of carbamide peroxide, it is ranging from 20% to 10%. So mostly it's 10 to 15%. Carbamide peroxide is also known as urea hydrogen peroxide. Concentration, as we told, ranges from 3 to 45, but normally is 15 to 20%. Mostly used in home use bleaching material. It is the mostly used in-home use material, bleaching material. The maximum concentration that may be used in 6% present or released. In broad term, 10% of carbamide peroxide content would yield a maximum of 3.6% of hydrogen peroxide. Thus, the commonly used products containing 60% of carbamide peroxide are permitted because they would normally be releasing less than 6% of the hydrogen peroxide, which is the safest side. So normally, as we told, it is 10 to 15% of carbamide peroxide are used. If we are using 16% carbamide peroxide, there will be a releasing of 6% hydrogen peroxide to the site, which is agreeable for the office bleach. Sodium perborate in other side available in powdered form or as various commercial preparation. So it in 3 types mainly we get is monohydrate, dihydrate, and tetrahydrate form containing 95% of perborate, providing 10% available oxygen, and material is stable when it dry. Now we are coming to the mechanism of action of material. Hydrogen peroxide plus urea from urea peroxide or carbamide peroxide, which is easily broken down in the presence of water to release free radicals that penetrate through the enamel pores and into the dentin to produce the bleaching effect. The breakdown of hydrogen peroxide into free radicals that penetrate through the tooth occurs via photodissociation or anionic dissociation or a combination of two. Once the initiation has started, both types of dissociation may occur. So hydrogen peroxide is an oxidizing agent that diffuses into the tooth, it dissociates to produce free radicals that attack organic pigment molecules in the place between the organic salt in tooth enamel by attacking double bond of chromophore molecule within the tooth tissues. The change in the double bond conjugation result in smaller, less heavily pigmented constituents, and there will be a shift into absorption spectrum of chromophore molecules. Thus, bleaching of teeth tissue occurs. So that is the way it all the free radicals, by the dissociation of this material, free radicals are produced, and these free radicals penetrate into the enamel and dentin, and it convert the dark pigmented molecule into light pigmented. In-office and home bleaching gels containing hydrogen peroxide or its precursor carbamide peroxide as an active ingredient in a concentration we have already discussed as 3 to 40% of hydrogen peroxide equivalent. Under photochemical reaction initiated by light or lasers, the formation of hydroxyl radical from hydrogen peroxide has been shown to increase. So these hydroxyl radicals are the thing which is participating in the bleaching process. So when we increase this radical, the effectiveness of the bleaching will be more. That is why this hydrogen peroxide activated by lasers and LED lights seems to be much better effective than normal chemical bleaching. So what happens normally is these darkly pigmented carbon ring structures are converted into lightly pigmented unsaturated structures, and later stage it completely bleaches stains hydrophilic non-pigmented structures. It reach a saturation point. Above the saturation point, again if we subjecting tooth tissues subjected into this bleaching material, it might cause breakdown of enamel matrix. So it leads to the decomposition of molecule structures, and later the carbon dioxide loss of enamel matrix water. It's complete oxidation. So there will be disintegration of enamel can occur. So we have to control the time. Time is very important. That whatever material you are using, accordingly you have to control your bleaching time. In the case of tetracycline stained tooth, which is very tough to bleach, the cause of the discoloration is derived from the photo-oxidation of tetracycline molecule available within the tooth structure. So the bleaching mechanism in this case takes place by chemical degradation of the unsaturated quinone type structures found in tetracycline, leading to a fewer colored molecule. The vital bleaching via a long-term night guard can sometimes improve the color of the tetracycline stained tooth. Normally, the tetracycline stained tooth can go for an internal bleaching. But if you go a continuous or multiple sitting in-office bleach, long-term night with a long-term night guard can sometimes improve the aesthetics. Now, types of bleaching. There are two types of bleaching. Two techniques of tooth whitening have been described. The first one is in-office bleaching by a professional in the office, and the dental clinic or hospital. It uses a photo activation. This one allows changes in the color of the enamel from the first session. The second one is ambulatory or home bleaching. Need an intraoral device or a tray, a custom-made tray to apply the gel of peroxide. The most cost-effective and the value of the dental color obtained is sustained for long periods, but important changes in this value are not observed before 7 days of treatment. So these are the two types of bleaching. One is in-office bleaching and one is ambulatory bleaching. So the rest of the bleaching we will be discussed in the next class. So today what we have discussed is what is the bleaching, what is the need of bleaching, and what are the indications of bleaching, contraindications of bleaching, inclusion criteria and exclusion criteria, bleaching patients, and what are the different causes of discoloration of teeth. And we have discussed with certain materials which is commonly used like hydrogen peroxide, carbamide peroxide, and sodium perborate, and what are the mechanisms of action of these materials. And we have finally discussed about two techniques of bleaching, in-office and ambulatory or home bleaching. So we will continue this topic in the next class. Thank you.